Hi everyone, my name is Hana Choi, and today I'm going to be presenting on the state and treatment of disabled persons around the world. So here's what we're going over today. Today I'm going to introduce myself, then I'm going to give a little bit of background, and then I'm going to talk about 3 different types of countries and how they treat disabled persons, and then I'm going to give my concluding thoughts. So hi, my name is Hana Choi, and I'm going to be a sophomore this upcoming fall at Robinson Secondary School in Fairfax, Virginia. I enjoy tutoring young disabled children, working with people in hospitals, and I just finished a medical laboratory internship at George Washington University. And as you can tell from my extracurriculars, I'm extremely interested in the medical field, more specifically neuroscience. I aspire to become a neurosurgeon in the future, studying and practicing for the global health community. And today I'm going to be presenting on the current state of education and rights for disabled persons in the 3 types of countries: developing, developed, and fuel exporting countries. And here's some things that you need to know about my presentation before we get started. So what does being disabled mean? Disability is defined by the World Health Organization as an impairment, activity limitation, or a restriction on participation. And these derive from environmental or personal factors or pre-existing health conditions. And approximately 15% of the world's population is affected by some type of disability, and 1/5 of those experience a significant disabilities. Currently, there is one international human rights treaty called the CRPD, the Convention on the Rights of Persons with Disabilities, created by the United Nations to protect the rights of disabled people. And here are the 3 types of countries we're going to go over today: developed, developing, and fuel exporting. United States, Mexico, and Iraq. The first country we're going to go over is America, a developed country. Currently in America, there are 61 million Americans who live with a disability. 1/3 do not have a regular healthcare provider, and 1/3 have an unmet healthcare need because of the cost in the past year. Currently, America has been known to be one of the most progressive countries in terms of legislation for the disabled people. One of the most prominent being the American Disabilities Act. Established in 1990, it was the world's first law of equality for disabled persons. And this legislation prohibited discrimination based on disability, preventing employers from asking questions about a disability during interviews and mandating accommodations in public areas. America has signed but has not ratified the CRPD. However, despite legislations, America has struggled with healthcare for the disabled persons. For example, pediatricians are unable to refer guardians to specialists, and there is a lack of ability to refer people to specialists. And the high cost and lack of accommodations remains prevalent in hospitals throughout the nation. In addition to this poor healthcare service, there's a lack of accommodation in high-risk situations, such as COVID-19. In an article, CNBC News reporter Alyssa Jackson states, disability has far not been concerned in public health emergency response plan or preparedness. It's not coming from preparation, it's coming from reactions. Next is Mexico, a developing country. In Mexico, there are currently 9.17 million disabled people and 33 psychiatric hospitals for those people. Currently, Mexico has been one of the leading nations in terms of rights for the disabled, a stark contrast to reports on the treatment of the disabled in Mexico. So what's going on? The shortage of facilities and lack of documentations of those, and the harsh treatment. Currently in Mexico, due to a lack of funding and documentation, there is a number of unlicensed and unregistered institutions. These institutions are often a target for human traffickers. In addition to the unhygienic nature of these institutions, residents of those institutions are often left to sit in their own feces or urine when there's no staff to clean them up, maybe even for years on end. Despite that, Mexican President Andrés Manuel López Obrador suggested that he would dissolve the National Council for People with Disabilities. He proposed such a decision because it apparently served no purpose. The same understaffed and underfunded institutions are often sites of harsh treatment and abuse. An investigator even testified on how he found children from 10 years ago in the same state, Only the children had aged to be teenagers or young adults. These children had been kept tied to their wheelchair or contained to their bed for their entire lives. This treatment causes severe effects, such as muscle atrophy and skeletal deformity. The World Health Organization condemns such treatment as cruel treatment with severe effects. Such effects include the aforementioned ones. In addition to those, lobotomies are often performed if patients do not respond to medication, and these treatments essentially render them useless and incapable of sudden active movements. Next, and finally, there's Iraq, a fuel exporting country. Unfortunately, there is a current lack of information pertaining to Iraq due to the current war-stricken state, but what we can estimate that over 9% of the population has some type of disability, and over 14.2% of children have some type of disability. This statistic would be much higher because officials estimate there's a constant increase of people with disability because of the war. We can conclude that the current state of things. So currently, Iraq has ratified the CRPD and passed several legislations in favor of the disabled community. However, it is common for disabled family members to be hidden from the public and be refused education due to the current state of the country. The CRPD is concerned and urges Iraqi officials to commit to rebuilding facilities for the disabled. And concluding thoughts. Currently, the United States of America is facing an issue with the lack of healthcare and the availability. So here's what we can do. America can make the disabled a priority in terms of medical care and emergency situations. Just put them on top of the list that need to be treated. In Mexico, there's harsh treatment of the disabled. So Mexico can check on institutions throughout the country, how patients are treated, and the cleanliness periodically. In Iraq, there is a lack of information on harsh discrimination. We cannot do anything about the current war-stricken state, but we can do things to help those disabled persons. We can enforce the legislation instead of just laying it there. Many people are not aware of these legislations and do not take advantage of it. So how can the international community improve? What can you do? Remember, a person's disability does not define how they are as a person, and treat everyone how you would like to be treated. Also, educate yourself and ask someone before you help them. Ask if they really need it. And most importantly, get involved with your local organizations. You can reach out to anyone in your area, and more specifically, if you're in Virginia or my area, Nova, you can contact neighborhood and community services, and it's so easy to get involved. You just have to reach out. Here are my references that I use for my presentation. And special thank you to the Global Health Leaders team for giving me this opportunity. And thank you to everyone who attended this presentation, and special thank you to Samara Rezwan for her feedback. Have any questions, please contact me through my email or direct message me through Instagram if that's what you're more comfortable with. And if you're in the Nova area and want to help out, please contact me or look up NCS Fairfax online to find more opportunities to help out. Thank you.